The Commerce Department just finished a 9-month investigation into something that affects every single American who has ever been to a hospital, and their report could be sitting on Trump's desk right now. Last September, the administration launched a Section 232 national security investigation, the same legal tool used to put tariffs on steel, aluminum, and cars, but this time the targets are pacemakers, wheelchairs, blood glucose monitors, surgical gloves, IV bags, and hospital beds. The review covers a wide swath of healthcare products, from surgical masks and PPE all the way to syringes and imaging equipment. The Commerce Department had until the end of May 2026 to hand that report to the president, and once he receives it, he has 90 days to decide whether to act. That window is open right now. Here's what the numbers say. Industry group AdvaMed, which has been lobbying for exemptions, noted that 70% of the medical equipment used in the United States is sourced globally. You can't just flip a switch and manufacture that domestically overnight, as much as I'd want that to be possible. Johnson & Johnson's MedTech division is projecting $400 million in additional losses if Chinese tariffs go through. Siemens is projecting between $235 million and $350 million. Those losses don't disappear, they get passed down to hospitals, to insurance premiums, and to you at the point of care. Higher out-of-pocket costs for patients are already expected to begin hitting in 2026 as insurers begin to reprice. Analysts specifically flag that Medicare, Medicaid, and the Veterans Health Administration will likely absorb a significant share of the added cost burden. This is the same playbook we've seen with steel, cars, and pharmaceuticals, but Section 232 gets invoked in the name of national security, and by the time the costs filter down to the ordinary people, the debate has moved on. The national security argument isn't wrong on its face. COVID exposed real supply chain vulnerabilities, but a blunt tariff applied equally to a surgical glove and a pacemaker is a different conversation. And even the U.S. Chamber of Commerce warned the administration that a one-size-fits-all approach is not appropriate given how different the circumstances are across these product categories. Precision matters when the product keeps someone alive. For veterans specifically, this is not abstract. Increased costs will likely flow directly into the Veterans Health Administration's budget. The men and women who wore the uniform, many of whom rely on prosthetics, mobility devices, and chronic care equipment, they're the ones sitting downstream from whatever Washington decides. The question worth asking your representatives, if this report becomes tariffs, who exactly is being protected and who ends up paying for it?